Hello, and welcome to my presentation on electronic healthcare records. Electronic healthcare records. What we're going to be talking about here is establishing what exactly are electronic healthcare records and when did they come about, who primarily uses EHRs, and for what purpose would they use them for. Some of the HIPAA concerns and patient privacy concerns with EHRs as we are transitioning to a mobile and technology-based society. Technical capabilities of EHRs, which includes data limitations and data storage capability. The pros and cons of EHRs versus traditional paper records. And then we're going to analyze 3 examples of EHRs, which will include the Epic Care Ambulatory Core EHR, the Allscripts TouchWorks EHR, and the Praxis EHR. So to start, what exactly are electronic health records? Well, according to a study done by Amenworth and Horps, they describe it as the concept of a comprehensive and cross-institutional and longitudinal collection of a patient's health and healthcare data. In short, an electronic health record is the documentation of a patient's encounter or visit or medical data that can be easily accessed through a diverse network of healthcare facilities for the purpose of treatment and diagnosis. In addition, Amenworth and Horps had identified that it was the early 1990s where electronic health records really started to conceptualize. Uh, Directly quoted, since the dawn of the concept of an interorganizational, comprehensive, patient-centered health record in the 1990s in the US, the different concepts of such a record, for example, computer-based patient record or the continuity of care record, the CCR, were always driven by the idea to support healthcare and to maintain, respectively, improve its quality. According to Furukawa et al., the Health Information Technology for Economic and Clinical Health Act of 2009, or HITECH, authorized the Centers for Medicare and Medicaid Services, CMS, to provide incentive payments to eligible hospitals that adopt and meaningfully use certified EHR technology. The reason why this is so important in the development of EHR and its use is that the federal government has put in place policies where it recognizes the value of using EHRs, not only for patient care, but also in the concept of quality assurance and the accuracy of medical billing, that they decided to incentivize major hospital systems and medical providers in adopting EHR technology and then also meaningfully using the technology. So ensuring that they're not just putting them in place, but that they're actually utilizing them for their patient care. This has really increased the popularity. In fact, the study conducted by Furukawa et al. Goes into an analysis of the dramatic increase in EHR adoption and usage from the years 2008 to 2012. And the theory is that some of that can be attributed to the fact that the CMS, or the Centers for Medicare and Medicaid Services, put measures in place to incentivize the adoption of these mechanisms of technology. Here you'll kind of just see an illustration or a flow chart on how an electronic health record is used today. To the far left, you'll see many different subcomponents of the healthcare industry in relation to how it provides care to the patient. For example, you'll see nursing documentation or nursing notes when they make their rounds within the clinics, albeit in an ICU or a pediatrics clinic. They're documenting those notes into a computer system or software platform that has been adopted by a healthcare agency. In addition, you'll see a lab and a clinical, radiology, pharmacy components where they are also documenting their notes for their encounters with the patients. Those then become consolidated within the electronic health record network that's then easily accessible to a patient's primary care physician, which gives them the benefit of coordinating care for that patient, predicting when interventions need to take place in the future, and also managing the patient's present disease complexes and medication. These are some examples of different areas of the healthcare industry that would be using electronic health records. It's going to include your private practice medical offices or private clinicians, clinical and outpatient laboratories alike, whether that be hospital-based or independent laboratories, pre-hospital emergency response, so most ambulance service providers, emergency management systems are going to start adopting the use of electronic healthcare records, medical specialty practices, pharmacy,